Thank you for joining us today. We're here with Grant Waterer, respiratory physician and Professor of Medicine, to talk about long COVID. One of the concerns with long COVID is the difficulty in diagnosing long COVID. What is it that makes it so complex?
So I think the problem with long COVID is that there's not a single test, there's not a blood test, there's not an X-ray, there's not a biopsy that can diagnose long COVID. It's really, because it's so many different symptoms can occur in different people, actually localising it down and being able to say, yes, that's long COVID is challenging for many people. And so the diagnosis is really based on having had COVID, having symptoms that are consistent with it, and then excluding other causes of those symptoms. And so it really is, diagnosing long COVID is a bit of a process of all those risk factors and then assessing people and saying, yep, that fits with long COVID.
And what's the best treatment once diagnosed?
Well, I guess I'd start with the best treatment is prevention. And we know that people who are vaccinated and triple vaccinated are much less likely to get long COVID than others. So, always go with prevention before treatment. But what we do know is that from similar diseases to long COVID, so for example, people who have these types of symptoms after long stays in hospital, critical illness, major surgery, major trauma, we know that the earlier we intervene with things like exercise, diet, getting sleep regimes back, the faster people recover. So, recognising that someone's at risk, early intervention, and focusing on things that we do know work is the best advice that we have at present. Now, over time, we'll get more studies, but there's no drug. It's not like there is a tablet that you can take that will take away long COVID. So this is very much about trying to get people to get back to normality through a kind of a staged process, while also having assessed them properly to make sure there's not other serious physical problems like heart disease or lung disease that might need to be treated.
So safety and being monitored regularly and working in constructive team care arrangements is really important for that recovery process.
Yeah, I think so. I mean, there is a risk of developing more severe heart or lung problems with long COVID. And so I think you would want to undertake any program having been properly assessed and looking for flags that might need higher levels of medical intervention.
Do we know anything about what causes long COVID?
So in different people it's different things. So what we know is that at the very severe end we can detect heart disease, lung disease, brain disease, kidney disease, muscle disease that's all been caused by COVID. We also know that there is a strong element in some people of a post-traumatic stress disorder, much like you have with any severe insult. And on top of that, there's a definite phenomena in many critical illnesses where people who've been to intensive care, had major surgery, had major trauma, get muscle weakness, they get nerve issues that can become chronic if you don't sort of get on top of them. And so all those factors can combine in any one patient in different combinations to give a variety of symptoms. And that's why kind of assessment is important. And it's why we also do need to sort of tailor our approach to what someone has.
And considering psychological and physical symptoms, by the sounds of that, are really important.
Absolutely. There's no question that the mental health component of this can be driven by the physical disease, but equally the mental health component alone can also drive the physical disease. So if both are present, you absolutely have to treat both if you're going to have a good outcome.
What impact could long COVID have, given how long it could take to diagnose and then the overarching management and treatment strategies? What impact could that have on the workforce and someone's capacity to engage in the workforce?
Really good question. So the data that's starting to come out, we know that in people, for example, they will take longer to get back to work. When they come back to work, they will not be as functional. So, difficulty in concentrating, for example, if you're in a intellectual type occupation, then, that can be significantly disabling. And obviously if you're in a position where you're making very key decisions, you want to be at your full capacity. If you're in physical occupations, then the sort of muscle weakness, the fatigue, can have very significant implications as well. So depending on your symptoms and depending on the role you play, given that these symptoms can last well out to 6 months or beyond, they can have very significant implications in the workforce, which again is why I think it's something that we do tackle really aggressively when we know someone's at risk, to try and limit that period of disability.
Grant, thanks for joining us today, and thank you for watching. For more information, head to our website chroniccare.com.au.